Hi there, I'm Nathan Turnbull with Florida Orthopaedic Associates. I'm an orthopedic surgeon. Today I'm going to answer some patient questions about joint replacement surgery. Here's a question from our new Smyrna Beach office. It says, what is a direct anterior hip replacement? A direct anterior hip replacement is a minimally invasive muscle sparing approach to the hip. A total hip replacement is when you replace the ball and the socket. We have a model here. And we replace the ball and the socket. We put a stem into the thigh bone, a shell into the pelvis with a plastic liner, and that's how we replace the hip. The difference comes with the approaches to the hip. And the anterior approach to the hip is the only internervous, intramuscular approach to the hip, meaning that we go in between muscle and we go in between nerves to gain access to the hip. With the anterior approach to the hip, we work through a small window in between these muscles in the front of the hip. Versus the lateral approach to the hip or the posterior approach to the hip, you have to split muscle to gain access to the hip. There's good evidence to show that the recovery is quicker with the anterior approach to the hip. The complication rate, such as dislocation rate, is lower. And we've had great outcomes performing the direct anterior approach to the hip. We have numerous patients who are able to go home the same day after surgery.